When I started to develop the Lyno technique, the whole aim was to bring my athletes back into body alignment. And it was only when I got introduced to the fascia and how much effect fascia has on alignment that things really started happening, especially in the field of chronic injuries and how to get rid of chronic injuries. So right in the beginning, the whole technique was based on mobilizing the fascia and releasing the fascia. So it was very much a hands-on technique where I would put my fingers on the skin and then attempt to move the superficial fascia on the deeper fascia. But then as years go by, we started to ask questions, but why did the fascia become locked up? And how did it become locked up? And it's then that I came across Porges's polyvagal theory, where he talks about the autonomic nervous system and how when you are stuck in the sympathetic zone, when the sympathetic nervous system puts you into that fight and flight, that's when the body braces up. And if the body braces up over a long period of time, it means that the fascia does not move, it dries out, and then the fascia became completely blocked. So then I started to think, but maybe we should move towards nervous system regulation rather, because if you could stop the bracing, then obviously the fascia will be mobile all the time, and then we won't have that stuck fascia and the non-alignment that is the cause of chronic injuries. So that's when I decided I'm going to take exactly the same Lyno assessment, which gives me the idea of exactly where the body is bracing, where there's locks and limited movement. And if I then focus on that, but I bring in the autonomic nervous system, then by just getting the athlete or the patient or the client into what we call the play zone, so the parasympathetic zone where the body lets go of the bracing. And as soon as we let go of the bracing, then the fascia is able to move again, and then we get the movement back and we get the alignment back, and then the chronic injuries disappear. So in this video, I just want to show you how we do it now compared to how we did it before when it was the manual technique. So everything at the moment is focused on movement and then focused on breathing. And we use specifically exhalation because the moment you exhale, the parasympathetic nervous system kicks in, the vagus tone goes up, and that's when the relaxation occurs. And if I can convince the brain that it is safe to move in the direction where it normally limits the movement, then we get rid of all those fascia restrictions, we get the movement back, alignment comes back, and then we get rid of all our chronic injuries. So I'm going to show here now how we do this, and I'm going to specifically use the movement of horizontal extension of the shoulder. So in other words, if the pectoralis and these muscles in the front become stuck because there is a continuous contraction there because of bracing, trying to protect yourself, that means that the fascia in this area will also become, the movement of fascia becomes limited. And then also there's obviously the situation where old trauma could be stuck and trapped in this area, and that also keeps it very locked and braced up. So what we do now is I'm going to ask Heidi, and Heidi's one of our practitioners, I'm going to ask her to help me demonstrate how we will guide her through the movement that normally is blocked and normally is limited. I'm going to ask her to exhale, and as she exhales and relax completely, we're going to move, I'm going to help her and guide her to move her arm actively backwards in the horizontal extension position. So it's very important, as I've discussed in the course, that we co-regulate, that the focus is completely on the area that needs to relax. It must be a very, very relaxed and calm atmosphere when we do this. So I'm going to ask Heidi to put her arm out towards the side. We want her thumb up, and we are going to focus on the fascia in this area. And the only thing I'm going to do with my hand is to just cue her, to just tell her where to focus, on which area to focus her brain on, so that that's the area where we will get the release. So Heidi's going to inhale first, and then as she exhales, she's actively going to move her arm backwards only up to where she feels the limitation. Come back again, inhale again, and then move. And as I say, the only thing I'm going to do with my hand will be to just guide and cue her as to where she should focus. And I am going to follow the rhythm of her breathing. So breathing is so important here, and if Heidi was not able to breathe, exhale properly, I would obviously first focus on teaching her how to do proper exhalation so that we can up the tone of the vagus nerve. So Heidi, I'm going to ask you to inhale, and then as you exhale, you actively take your arm, and all I'm doing is cueing her on exactly where to do the movement. And the most interesting thing here is that somebody could be completely locked, that they get maybe 10 or 20 degrees of the 60 degrees, which is the norm for the normal range of movement there. People could be completely blocked, and as they relax and as we guide them through the movement, you can actually all of a sudden just see how the body just relaxes, releases, and we get the full range of movement. And it's always interesting because you can actually see it on the client's face as well, that they, wow, it feels as if it just glides back. So this is the technique that we use, whether we use it for the neck or all the way down to the toes. It's always the active movement, moving towards the range of the limited movement, using the exhalation, breathing out as we do the movement actively, and then I use my hand to focus on the area where I want their brain to focus. This is the area where we want to relax. So sometimes we have clients who do not like the touch. You could use just tapping, or just put my hand gently on the area so that she knows, okay, there is where she needs to focus. So it's not really about what my hands are doing, but it's all about the co-regulation, the breathing, the focus on moving in that exact area. And it's just amazing always to see how beautifully it releases when we use the autonomic nervous system.